morning and welcome to UroNurse News. I'm Vic Senese, and today we're taking a closer look at an important and often debated pediatric urology question. Can treating phimosis in infant males reduce the risk of recurrent urinary tract infections? Recurrent urinary tract infections. Make sure you got that. A newly published systemic review sets out to answer exactly that. The objective of this review was to evaluate whether treating phimosis either through circumcision or topical corticosteroids is effective in preventing recurrent UTIs, also known as RUTIs, in male infants who already experienced a UTI, thus recurrent. And that distinction is important. These were not infants without prior infections. By the way, in case you're wondering about this picture over here, it's a Wenzel dog from Disney Springs. I'm always looking for pictures in nature that I can use for a talk, and, well, this one just seemed to look right for circumcision. Researchers conducted a comprehensive systemic review, that should be systematic review, following the PRISMA guidelines, searching multiple databases including PubMed, Embase, Cochrane Library, CINA-HL, Scopus, Web of Science, and clinicaltrials.gov. This search included studies published throughout September of 2024, and only English language studies with primary data were included. Infants had to have a prior UTI, as I mentioned, to be eligible. Now, 2 independent reviewers screened abstracts in full text, and a 3rd reviewer resolved disagreements. Study quality and risk of bias were assessed using the Joanna Briggs Institute critical appraisal tools. Out of 3,283 abstracts, 69 full-text articles were reviewed, and in the end, only 4 studies met all the inclusion criteria. So what were their findings? 2 studies examined circumcision. Here's what they found. Among uncircumcised premature infants, 31% experienced a recurrent UTI. In uncircumcised full-term boys, 11% developed a recurrent UTI. But none of the infants who underwent circumcision experienced a recurrent UTI. 0. Topical corticosteroids. Findings. 2 additional studies looked at topical corticosteroids for phimosis. Among 27 uncircumcised infants treated with topical steroids, not a single recurrent UTI was reported. In contrast, among 165 untreated infants, 16% experienced a recurrent UTI. Now that's a meaningful difference. Phimosis resolution and retractability. One study compared topical corticosteroids to simple lubrication. 90% of infants treated with topical steroids achieved phimosis resolution. Only 21% improved with Vaseline alone. Infants were also recategorized by foreskin retractability. 7% of infants with a retractile prepuce developed a recurrent UTI, compared to 30% with a non-retractile prepuce. This study suggests that prepuce retractability itself may play an important role in UTI risk. So what were their conclusions? This is the first systematic review to specifically examine phimosis treatment as a strategy to prevent recurrent UTI in infant males. The findings suggest that both circumcision and topical corticosteroids may reduce recurrent urinary tract infection risk. However, the evidence is limited, the number of studies is small, and the data was insufficient for meta-analysis. The authors stressed the need for high-quality, prospective studies to better define the prevention role of these interventions. Hey, what if the immune system could be trained to recognize and destroy ovarian cancer? Tomorrow I break down groundbreaking research showing how new nanoparticles may stimulate the immune system to attack ovarian tumors, a promising step forward in cancer treatment and immunotherapy. What's this mean for patients? Could nanotechnology change cancer care? And why should clinicians be paying such close attention? Tune in tomorrow at your favorite BASS station to find out. Join me for a clear, clinician-friendly look at science shaping the future of oncology. As always, shared decision-making and clinical judgment remain key. I'm Vic Senese, and this has been UroNurse News, bringing you evidence that informs practice. And don't forget to like and subscribe.
UroNurse News, we've got the scoop, helping you stay in the healthcare loop. from Monday to Friday.